Talk about your healthy living now. Suicide is a significant concern in our country, especially among the population of military, young adults, children. Well, this week is recognized as National Suicide Prevention Week, and we're going to focus on the kiddos now. Dr. Campbell, a child and adolescent psychiatrist from Manning Children's Hospital, is here with us to talk about this. And we were talking in our green room, and Doctor, you were saying that it's the second cause of death in children or in teenagers, second to accidents. Talk about what a big deal this is.
That's right. Among youth ages 15 to 24, suicide is the second leading cause of death. And it's such a heavy topic. So thank you for bringing it up. It's an important thing to talk about in our communities and how we can raise awareness and intervene when able.
Yeah, so how much of this is an underlying condition that leads to suicidal ideology versus social pressures? What do you usually see?
Well, you know, youth today are faced with a myriad of challenges. And what we do know is we know that a lot of stressors and social pressures that kids face, performance pressure, academic pressure, conflict at home, a lot of what's going on with social media right now, these are all things that increase rates of depression and anxiety, which then lead children to be more vulnerable to ideology of suicide or self-harm.
So a lot of parents that we hear about almost like didn't see it coming. You hear that a lot. Yeah. And the very scary case that's been in the news of ChatGPT assisting a child, and that case is very much in court right now. Talk about how you tell your children, look, I know that you use these resources for a lot in your life, but this is not real. How do you have that conversation with your kids?
Yeah, that's so terrifying, right? And it's a brave new world. A lot of this is a big learning curve for young people and adults alike. And so I think a really important thing is to be transparent with our youth, to talk about how, hey, it's really important to talk to a trusted adult. Yep. I want you to have people you can go to talk to. There are dangerous things on the internet. You know, a lot of dangerous things on the internet exist. ChatGPT is a big unknown right now in where it's going to go and how it's going to develop. And then there's a lot of the dark web that we say, and we're hearing all the time about being a negative influence.
I try to destigmatize for our audience what it's like to go to Children's Hospital and say, hey, my kid's having some psychiatric issues, because a lot of people don't even want to put those words out of their mouth. Talk about what the process is like.
Yeah, the stigma is very real for children and adults alike. I have heard a lot of adults feel worried, oh, they're going to label my child or put my child on heavy medications or things like this. And I would say, you know, nothing's going to happen that everybody doesn't agree is the best case. And so a lot of times just bringing up any concerns, even if it's just for reassurance or even if it's just for resources. At Manning Family Children's, we have an ER for any crisis issues. We also have, if a young person is having suicidal thoughts or self-harm, we do have an inpatient hospital, 51 beds where they can receive a high level of care.
Dr. Campbell, can't thank you enough. Such an important conversation, and we'll have it online shortly.